Welcome to today's explainer. We're jumping right in today because we are breaking down the exact science and, frankly, the strategy behind achieving a flawless, completely natural-looking smile makeover. And I'll give you a massive hint right out of the gate. It is not just about booking a random dental appointment. It's about a highly coordinated master plan. We're going to dig into the source material today to uncover the real blueprint behind those stunning smile transformations you see, and why the order in which things are done is absolutely everything. But first, when you look at someone and immediately think, whoa, those are definitely veneers. I mean, we've all seen it, right? It's that super frustrating side of cosmetic dentistry where the final result ends up looking artificial, mismatched, or just kind of distinctly two-toned. You invest all this time, all this money, and instead of a natural enhancement, you get a smile that looks, well, bolted on. So what exactly goes wrong in these cases? And more importantly, how do the real experts prevent it? Well, here is our master plan for today's explainer. 1. The patchwork smile problem. 2. Why sequence determines aesthetics. 3. Cost and corner-cutting risks. And 4. A real makeover case study. Okay, let's start with section 1, the patchwork smile problem. A lot of times, we don't realize how minor, everyday dental complaints just sort of quietly stack up over time. Usually, we don't even notice until we look in the mirror one day and feel unhappy with the whole picture. But fixing it comes down to two very different approaches. You've got the patchwork fix, which is what happens when you just chase individual problems separately. Fix a tooth here, whiten another one over there. The source material makes it super clear. Treating uneven and discolored teeth one by one like this is slower, it's way more expensive, and it leaves you with unmatched colors. Then you have the cohesive result. This is the secret right here. It's treating the entire front-facing smile as one unified design problem, so the whole shebang blends perfectly. And treating it as a unified problem is so crucial because of how these issues combine. Think about common, stacked dental problems. We're talking about slightly rotated teeth, years of coffee, karak tea, or shisha stains. We all have our favorite vices, right? Plus maybe old chips from childhood or minor gaps that naturally open up as we age. The reality is, most patients don't just have one of these issues. They have a mix of them all at once. So a single standalone fix rarely works because, well, fixing the shape of a tooth doesn't magically fix the stains on the tooth sitting right next to it. Moving on to section 2, why sequence determines aesthetics. Now listen, if you take away literally one thing from this entire explainer today, let it be this. When you are dealing with a combination of uneven and discolored teeth, sequence determines aesthetics. Full stop. Doing things in the wrong order is exactly how you get that fake two-toned look. There's a 3-step order that guarantees a natural result. Step 1. Whiten first, always. You have to lift the color of your natural teeth before doing anything else, because once a porcelain or composite veneer is bonded on, its color cannot be changed. No way. Step 2, the 2-week color settling period. And step 3, design the veneers around that completely new, brighter baseline. Actually, let's zero in on step 2 for a second, because this is the absolute deal breaker. The 2-week color settling period is the crucial wait time for whitened natural teeth to stabilize to their true final color before you even try to match veneers to them. It is the power of the pause. See, whitened teeth actually continue to shift and stabilize for about 2 weeks after the whitening treatment is over. If you skip this wait, you are literally guaranteeing a mismatch down the road. And to make doubly sure that sequence plan is going to look great, top-tier clinics use digital previews. This guarantees that you and the dentist agree on the final natural look before a single drill is picked up or any enamel is touched. Avoiding the artificial, blocky veneer smile relies heavily on planning small, natural variations between the teeth and picking a realistic shade that actually suits your skin tone. You get to see exactly how much correction looks right, so you don't end up mathematically identical and totally weird looking. All right, let's get into section 3, cost and corner-cutting risks. Now that we know why sequence is everything, we really need to address the elephant in the room, pricing, and the hidden dangers of cheap, rushed alternatives. There is a massive red flag mentioned in the source material that you have to watch out for. It notes that a budget provider skipping the 2-week color settling window will shade match veneers to tooth color that hasn't finished stabilizing. If a clinic rushes the sequence to save a little time or money, they are locking you into a permanent mismatch. And honestly, the worst part is, you usually won't even notice the mismatch until a few weeks later, when your natural teeth finally finish settling. By then, the only fix is an incredibly expensive remake of the entire set of veneers. So to give you complete transparency, let's look at the actual material costs outlined in the source, specifically for the market in Muscat, Oman. Whitening runs between 40 and 120 OMR. A composite veneer is about 50 to 150 OMR per tooth. It's definitely faster, but it's less durable. But a porcelain veneer, which reflects light way more naturally and just lasts much longer, will run between 150 and 350 OMR per tooth. And material choice is huge here. Porcelain holds its shade and fights off those tea and coffee stains infinitely better than composite does. So when you put all of that together, a typical full combination case, which is usually professional whitening, plus anywhere from 2 to 8 veneers, is going to cost somewhere between 700 and 2,500 OMR. That should give you a really realistic bottom line anchor for what to expect when you're planning this out the right way. Because at the end of the day, proper sequencing and individualized planning upfront is almost always cheaper than paying twice to fix a botched, mismatched result. Going for the absolute cheapest quote out there often means you're getting generic, cookie-cutter veneer templates and skipped waiting periods. Those are false economies for sure. They result in a smile that looks noticeably done rather than natural. It is always, always more cost-effective to respect the sequence the very first time around. Which brings us to Section 4, a real makeover case study. Let's see how this all comes together in the real world. We've got a really relatable case study here of a woman in her 30s. She was dealing with inward rotation on her front teeth and years of built-up tea stains across her smile. Look at how beautifully efficient a properly sequenced plan is. On day 1, she goes in for a second opinion and gets a combination plan. For weeks 1 and 2, she does a take-home whitening treatment to lift her overall shade. Then, and only then, during weeks 3 and 4, the dentist color matches and bonds just 2 porcelain veneers directly to her rotated teeth. So in literally less than a month, just by following the exact right order, her smile is completely transformed. But here is the crazy part. Compare that to her original quote. She was initially told by another clinic she needed 8 veneers just to match everything, which was incredibly expensive and completely excessive. But the smart sequence plan, whitening first, doing the weight, and then perfectly matching just 2 veneers to her new shade, ended up costing roughly 1/3 of the original quote. Sequencing correctly saved her from being drastically overtreated, and she still walked away with a totally seamless blend. Of course, once you get that perfect result, you gotta maintain it. You keep it looking even by doing a quick whitening touch-up on your natural teeth every 12 to 18 months. Why? Because porcelain resists stains better than your natural enamel does, so slight shade drifts over time are totally normal. Other than that, you want to avoid tea and smoke for the first week when your enamel is still a bit porous, wear a night guard if you're a tooth grinder, keep up with those standard 6-month checkups, and whatever you do, avoid using abrasive whitening toothpaste on your shiny new veneers. And hey, just so you know, we aren't just taking one clinic's word for it. This entire protocol is deeply grounded in science. The peer-reviewed clinical literature on minimally invasive aesthetics confirms that shade coordination between whitened natural teeth and bonded restorations is the key factor in long-term success. So the research absolutely 100% backs up this exact sequencing protocol. So I want to leave you with a final, slightly provocative question to chew on the next time you look in the mirror or sit in a dental chair. Are you just fixing teeth, or are you planning a smile? Because as we've seen today, beautiful aesthetics do not happen by accident, and they certainly don't happen by rushing. They happen through careful, perfectly sequenced planning. Thank you so much for joining me on this explainer today. Keep learning, keep asking the smart questions, and I will catch you on the next one.